Let's turn now to our health spotlight and welcome in Wish TV medical expert and former Surgeon General Dr. Jerome Adams. Dr. Adams, COVID spread and cases are down all across Indiana. We're seeing hospital numbers plummet as well. Let's talk about that a little bit. Are we past the worst of the Omicron surge?
Well, I do think that we're past the worst of the Omicron surge. As you mentioned, cases, hospitalizations, positivity rates going down. But it's important to remember, we still had almost 3,000 people die in the United States yesterday, 15,000 over the last week when you look at our 7-day average. Still a lot of pain and suffering for a lot of people out there, mostly the unvaccinated, but it does look like things are trending in the right direction.
So we've had several school districts in Indiana and schools all around cities in the country to this week drop their mask mandates. We know the political arguments and the position of many parents, but medically and scientifically, is this the right time to begin ending those?
Well, medically and scientifically, it's the right time to have that discussion. We are coming down, but if you're driving 110 miles per hour and the police officer pulls you over when you're going 90, you can't say, well, I'm better than what I was doing just a few miles back. We have to remember we're still in the orange, still in the red in many counties across Indiana. And I just want people to have discussions about the metric, cases, positivities, hospitalizations. And I'd also really like to see school districts say, hey, we're going to do this, but we need you all to continue to get vaccinated, continue to get boosted. So if masks come off, we're protected better so that they don't have to come back on again if we get a new surge.
Dr. Fauci has suggested that the COVID pandemic could be over this spring. Not that the virus is gone, but that it starts to be like the traditional flu. Do you agree? Is that too optimistic?
Well, what he said was the pandemic phase in the United States. And I do agree that this spring is going to be much better, and hopefully this summer, because more people are getting vaccinated, more are getting boosted. Important to remember right now, the majority of people dying from COVID, and there still are quite a few dying, are unvaccinated. So the way to make this be like the flu for many people out there is to make sure you get your vaccination, make sure you get your booster, so we can enjoy ourselves this spring and summer with a little more freedom and a lot more safety.
Dr. Adams, it's hard to believe, but this is actually our first chance that we've gotten a chance to talk since the FDA on Friday approved Lilly's new COVID treatment that targets Omicron. How significant is that approval, and who can take it?
Well, Alexis, the name is bebtelovimab. Say that 5 times fast, but it is significant. It's really important because Lilly's prior monoclonal got pulled off the market along with another one. We were down to just one medication, and then the oral antivirals were approved to get us to 3. This makes a 4th in our arsenal. But the most important thing is that people get tested if they have symptoms and go to their doctor so that they can get put on these treatments, because these treatments mean nothing if people don't go in, get tested, and get put on them.
Federal regulators have also delayed a decision on COVID vaccines for children under the age of 5. Does that delay concern you at all?
Well, what I want people to understand is these vaccines have been shown to be safe in people under the age of 5, based on the data available so far, but they're trying to decide whether you need 2 or 3 doses. And what they didn't want to do was approve 2 doses and then turn around and have to change it later on because they found 3 doses would be more effective. We've already seen how much that's frustrated adults when that happened. So I think it was the right move to delay it a bit. Parents are frustrated, but it's why we need to all continue to do our part to create a safe environment around those kids under 5 who can't get vaccinated, with masking and still with focusing on vaccinations and boosters.
And Doctor, real quick before I let you go, I've been seeing some cities declare that they believe that COVID is now an endemic phase. Is it too soon to be having that type of conversation?
Again, it's not too soon to start talking about it, to say which metrics should we be looking at to start to ease restrictions. But scientifically, no. We are not in an endemic phase yet. Endemic means you're at a low baseline steady rate. We're not there yet. We're still going 90 miles per hour in a 55 mile per hour zone. We were at 110. We're slowing down, but we're not where we need to be quite yet.
Dr. Adams, thank you so much for spending some time with us.
Of course. Thank you.